the virus, and we have half-baked truths coming out every day. So the stress and uh, the pressure on a journalist to report the right news and in a proper manner, in depth, not a distorted manner, is even more. And the appetite for news in India is well known. But in a crisis like this, everybody looks at the media for at least getting some credible information, some trustworthy information to deal with the crisis in the pandemic. So this infodemic that has now come in with the social media and other print has gone out because we don't get the printed editions. So online, television, audio, podcast, we get so many information sources. What are they doing and how are they feeding into the pandemic are some issues that we will be talking about. So I really want to flag here all the, I think, media colleagues and professionals and who have been on the forefront. We talk a lot about the doctors and the medical practitioners. They obviously need our hats off to them. They are the heroes of this particular crisis. But I think the media and the journalists who are right now in the field and doing their job, like Patricia and Pankaj right here, and the whole team that they're working with, also need to be kind of acknowledged and appreciated, that they are able to put in so much time and effort and giving us uh, the information in such a crisis mode. So yes, they are also heroes. They are also somebody who need to be acknowledged and supported in every way possible. And that's why I'm grateful that UNESCO is thinking in terms of safety and security of issues of journalists. So with that, let me introduce you to our panelists. As I mentioned, we have Mr. Pankaj Pachoriji, who's a well-known journalist and TV anchor. He was the advisor to former Prime Minister, and he is currently the founder and editor of Go News. It's a app-based TV news channel, and if somebody hasn't seen it, I highly recommend subscribing to it. It's something that is worth subscribing to and following on social media also. The other panelists, thank you, Pankajji, is Patricia Mckee. She's a Padma Shri and a very well-known journalist and a social activist, I would call her. She's been awarded many awards, including the Chameli Devi Award. And she is the editor of Shillong Times, a very well-known in English daily that has been running for a long time now. Welcome, Patricia, and thank you for being part of this panel. Very few people actually take out time to be here, and Sagrika was one of the persons who actually I've been talking right from the beginning, and she was very excited to be part of this, but her mother had to be admitted to the hospital and at the last minute had to drop off. And this is, again, a crisis of the times that we are living in, and unexpected happens all the time, and especially health risks that we hadn't expected or anticipated earlier. So this is something we are all dealing with. I'm glad to have Dr. Nimesh Desai, who's going to join us in a few minutes. He's a well-known psychiatrist at the IHBAS, which is the Institute of Human Behavior and Applied Sciences, Government of Delhi, and he's been practicing as they call it, he's a shrink for a long time, and he understands how media is working. So we will draw on him to talk about how individuals can make themselves more sturdy in these times of crisis. And finally, last but not the least, Mr. Hezekiel from UNESCO, who I will give the initial floor to, has been 30 years experience in communication and information policy and practice, especially in Africa. And in other developing countries. I really want to flag here that he was in charge, he has set up a network of African centers of excellence in journalism education. And I'm glad that he's there in India, and with his experience, we can also influence and make journalism much more healthier than it is right now in our country. So thank you, Hezekiel, for joining us on behalf of Mr. Eric Falt, who's in France and he could not join us at the last minute. But the floor is yours. Please tell us what you feel about the concerns of media professionals, and then we'll open the floor and bring in Patricia and Pankajji and Dr. Nimesh.
So yeah, thank you very much, Dr. Vasanti, and Our thanks go to the Center CMS and the team over there for this great idea to organize this session. Well, as we know, the global health crisis has brought the world to a standstill and affected several essential services, and media is one of the worst hit sectors. From economic crisis to safety of journalists reporting from the ground, the press is facing a range of issues right now. In countries around the world, journalism is being considered an essential service, and journalists essential workers, with the permission to continue reporting and to be exempted from movement restrictions. However, this comes at heavy cost. Reports on in the Indian media have confirmed several cases where journalists have tested positive for COVID while reporting on COVID. Apart from the physical safety, the dangerous phenomenon of disinfodemic that spreads as fast as the virus itself has also been a challenge for the media everywhere. At a time when many seek information online, primarily, the role of professional journalists is vital. It is also important to help the media and journalists report on the crisis effectively and safely, and to promote critical thinking to limit the spread of rumors and misinformation. So really, what we want to highlight here is, with all these challenges of safety, disinfodemic, and even personal and physical compromise to the lives and well-being of the journalists, the situation has become more severe than we even initially thought. And we would like to really say that UNESCO is doing its part, trying to do its part to promote, or at least to highlight, first of all, the seriousness of the situation, but also to advance the UN programs and UN approaches to promoting safety of journalists and media, and not only in India, but of course globally. But in case of the New Delhi office, we are focused with South Asia. And in this context, perhaps I can also mention that we have a few initiatives. One is a project that we're glad to work with CMS on, which focuses on the safety of women journalists, because we have found, not only us, but it has been widely accepted that there are safety issues that can be quite unique to our women journalists, and they need special attention and special approaches to address. But coming back to the bigger problem of COVID, we have seen from a study from a New Delhi-based rights group that nationwide, there are 55 Indian journalists that have been arrested, booked, or threatened for reporting on COVID. So the safety goes beyond the day-to-day encounters, but also goes to the environment. How enabling is the environment for journalists to work freely in? This is a threat to freedom of expression. This is a threat to press freedom and media freedoms. And it is a threat indeed to the safety of journalists. So we, as at UNESCO, we are not only advocates, but we have initiated programs that address the safety issue, but also programs that promote standards like ethics to counter, for instance, this issue of misinformation, disinformation, and in many cases, stigma, which goes with the two. Sure. And these are the issues that really we feel media should promote and should engage in as we go forward. I think with those remarks, I will leave the floor for others to intervene. Thank you very much.
Thank you so much, Hezekiel. I think that's very much required, and I'm happy that the UN, and especially UNESCO, is looking at journalism, especially media freedom, and making an enabling environment. We'll come back to you towards the end to look at more how organizations like UNESCO and others can support what the journalists are going through right now. But let's hear from, I'll open the floor to Patricia and Pankaj right now to talk about how things have been different for journalists. Let's hear from them about how COVID-19 has changed life and work of a journalist, and specifically with respect to working from home and the stress and the issues of coordination that brings with it. And I really want to hear from Patricia, perhaps even from Pankaj if required. Are there any gender differences in this particular impact, and are women facing it more or less? Or let's hear from that. So Patricia, over to you first, and then I'll ask Pankaj to join in and to answer the same question.
Thank you. Thank you for this opportunity to share a few concerns. So I feel that, I've been thinking a lot about our reportage during the COVID phase. And I find that it has subsumed all other issues. We have issues of crime, issues of domestic violence and sexual exploitation of women, which must have increased now, because I was watching the news the other day, what was happening in Chitrakoot, where young girls were exploited sexually and paid just 100 or 200 rupees for their services. See, poverty now has exacerbated. And I think it is our duty as the media to bring that to the open. So I know I should not be going out because of my age, but I'm still going to the rural areas and to the satellite markets where a lot of the sellers there are actually women. And most of them, it's quite an irony that we are in a matrilineal society, but we have a lot of single women, headed households, because they've been abandoned, they've been divorced, and there's no maintenance. So many of these women there are about 250 odd stalls, and almost about 99% of these stalls were headed by women. They were selling just, 5 kilos of bhindi, 5 kilos of, I don't think they would earn much, but they have to do it because they have to subsist. So that is a kind of a subsistence living. And then for journalists per se, it's become very, very difficult. It's a catch-22 situation, because on the one hand, there's nobody to protect you. No, the state has not offered any protection. Our journalists are still going around without their PPEs. And then there is also this fear hanging over us about losing our jobs. So there's that economic insecurity, there's the health insecurity, we don't have health insurance. I mean, see, with all this, we are still faithfully reporting and faithfully bringing out the newspaper. We haven't shut down even once our printing. So that's the situation here. In our state, at least, we had the WHO lauding us for being the state with the least number of COVID at one time. But even we have now climbed up to 121 cases, which is very small compared to all the other states. Out of the 121, there are 121 are active cases now. There are 45 people who've recovered, and there were 2 deaths. So the way we report is also so important. This is the time when you've really got to work very closely with the district administration, with the government, because if you place news in a particular way, they say that you're creating more of sensation instead of cooling tempers, instead of bringing in a certain calm, because people tend to panic a lot. So we have to be so careful about the words we use, about the way we place the news, and also at the same time, carrying out certain do's and don'ts every day, so that people don't forget those do's and don'ts. Then we also have to deal with fake news. We are the ones who have to clarify that such and such news is fake, such and such news on WhatsApp, on Facebook, on other media is fake. I mean, I don't think that should have been our responsibility, but it has become willy-nilly. So with all these issues, I think we really are not in a position to understand where we are today. We are just moving from day to day. We're living from day to day, not knowing what the next day brings. We're just sort of managing our lives.
Patricia,
And
I just wanted to cross-check that you haven't had to in the lockdown and since then are not closed even once. So you're working full time, you and your whole
yes,
journalist
yes,
team
yeah,
at Long Times. Is
yes,
that
yes,
right? 'Cause
yes,
that's quite rare. I think none of the media, very few media people have done that. Most media houses have either working from home or working alternate days or shut down few or stop printing or something or the other. But you may be the only, perhaps few of the only media in India who hasn't changed their working style because of the COVID,
yeah.
right?
So our reporters have been on the ground always, always, and even the desk people, the desk staff have been coming to office, and of course they're maintaining their social distance and personal hygiene and all that. But we haven't stopped printing even for a day.
Wow, that's really commendable and something very brave to be doing it in this kind of epidemic. But I think the situation in Delhi is drastically different, and
Yeah.
I'll hand it over now to Pankajji to talk about how different things are in Delhi, like city, where the media is actually concentrated, and he being in this sector for quite some time has seen the metamorphosis, I would say, to the media. It has happened. I have been doing these studies for UNESCO, and I've been talking to a lot of my media friends, and the stories that I'm getting to hear, the insecurities is tremendous, especially the work from home stress that most of them are following. I know Pankajji likes facts and figures, so before he starts, can I just share something about the study that I mentioned? We did an online study recently with journalists to talk about their concerns, and Pankajji, 70% experience stressful work-life balance. They have reported since lockdown, and even with those 70%, they feel 30% have been talking about the stress that they feel daily. And the issue, that the scary part is that among them, 70% are fear getting infected, and 80% fear the loss of jobs and wages, which is even more scarier. So yes, there is this whole atmosphere that has been created out of fear of a virus. I think that is more fearful than actually the virus itself.
Yeah.
Over to you, Pankajji. Pankajji, your volume, your mic is off.
Thank you very much, Vasanti. Thank you very much, UNESCO, for supporting this webinar. It's very important to talk about how the media people are working and how they've been faring in this. And from your figures, it's very clear that 80% of media people fear job losses, and 70% of media people fear for catching the infection. So you
Yes.
can imagine that the situation in media is basically, it's a two-pronged challenge we are facing. We've been working like Patricia. We've been also our office has been open since 22nd of March. Only 10% people come, but still we have to run the office and open it. I am in our office is in Noida. I live in Delhi, and you can imagine the kind of stress which is there. This is the first time in my life I've covered all kind of crisis in this country in last 30 years of my journalism, but it was the first time that as a journalist I was stopped from getting A to B. And for the first time, I thought that this pandemic is the worst which has happened when it comes to media. When the policemen stopped me from entering in UP. I said, I'm a press person. I've gone to Kashmir. I've covered all kind of riots, and there's nothing which can stop me from going to a place where an event is happening. He said, "Nahi sir, hamare paas mein, we don't have, you don't have a curfew pass, and you have to go back." And that's what I felt, that how media is affected totally. So that's one part of media. We have a lot of women also, Patricia, and they've been working. And every third day, I keep asking them and requesting them to take all kind of care during this time. And even the menfolk, one of our journalists actually caught the virus, had to be isolated, and he had a very bad impact on his, because of the mental stress about his family and about his parents and wife, that we've given him a long holiday to be at home and come back, and he's been asked now not to venture out of the house and completely work from home. So these are the things that we are facing, as most of the media people are facing. But the biggest thing, as the fear of financial insecurity, that is the crux of for media right now, because the first cutbacks which companies do are on advertising.
Absolutely.
And that is what started happening in a big time. I'll just give you some figures. I'm part of CII Media and Entertainment Committee, and I have some figures which we've been talking about. We've been talking to the government about it. So the print was supposed to increase by 4 to 5% before the pandemic hit us, and now it's gone up. It's about 60% less. That's in the negative. So you must be watching and looking. If you get the papers at all, then you'll see how the newspapers have become very small. They are not publishing so many advertisements and all that. And so that's one thing. People are not buying papers. In the colony I live, I asked the newspaper hawker. They said that 70% people don't want papers anymore. And it has continued. People don't want to touch newspapers and all that. So that's another reason that the print is going to be impacted very severely. Along with that, if you look at the television, the News Broadcasters Association had written a letter to the Minister for Information and Broadcasting that the news television's advertising has come down to 50%. So you can imagine that an industry which was already feeling a lot of pressure, the television increase was only about 10% in the last few years. It has gone down to that. Online, to which I belong, and everyone thought that the online is going to win big time because more advertisers and more people will be coming online. That has not happened. So if you look at the online was going to increase by 21 to 26% annually this year, according to FICCI and CII reports. It is, in terms of revenue, it's going to actually decrease. In terms of viewership, it's going to increase. Our platform is also, since February and March, has gone up about 100% or something. I mean, it's doubled, our viewership is doubled and everything, but the revenue is totally stopped. And that's a big challenge for the young companies like ours to, to continue. And so that's what it is. Now, coupled with this, I'll just finish that. Coupled with this is that besides private companies in India, the advertisers and sponsors of media are mostly the government.
Yes.
So what has happened now that the government is the only big player which is left in the market for advertisers. If you do not report or do not broadcast what the government wants, so that revenue stream is also gone from your hands. So that's been happening, and that is the reason why, if people are wondering that why are all the newspapers or the television channels are speaking the same language, and they are pandering to the government, even if it's not dealing with the pandemic effectively, even if there are lots of problems which are happening, even if our land has been taken away by a neighbor, why the media is pandering to the government. And this is the reason that the government has now become the largest advertiser and sponsor and a revenue stream for the media in the country. And that has created a serious problem in terms of freedom of speech, expression, and what Hezekiel just said, that 55 Indian journalists have been either detained or arrested for reporting on the pandemic. So you can imagine that how difficult it is at this time
Yes.
to represent the people's voice in terms of sustaining yourself as a media organization and also sustaining your independence. This is the worst time for media in India, I can say, that one has worked in. Even during the emergency, people had a choice to go to jail, and many media persons were sent to jail. But this is throttling their revenue and shutting them down almost. That is what's been going on right now, and that is very unfortunate in a democracy of our scale and depth.
I couldn't have agreed more, Pankajji. I think you very well summarized the crisis in terms of the structural issues that the media is facing in terms of the media freedom and ethics and the way journalists are working. Before I go to Dr. Desai, I wanted to actually just flag one issue because we're only talking about the epidemic right now and the effect of the epidemic, and obviously the consequences, which are many of them, but we'll focus on few of them and let's go a little bit more in depth. The one of the fact that you mentioned about smaller organizations like yours, but what is most scary for me, and I guess all people who are interested in this particular profession, is to see even larger organizations which are reporting 200 crores plus revenue in their books are firing people at the lowest level and cutting wages, and the fear that you mentioned of the government perhaps at one stage, but the fear of losing jobs is something that again something which people are living with. You don't know tomorrow if your job is going to be there, and plus I am working from home. I don't know. I don't know whether the buzz, the dynamic newsroom scenario that I used to thrive on, and you will notice most journalists literally thrive on, and the resources and trying to find their news sources, getting contacts, all that is now literally done from home. So how things have changed working from home. Not everybody's working from home, but most of them are working from home. And here I want to bring in Dr. Desai and to talk about, sir, what are you? I mean, you are a very eminent psychiatrist living in Delhi for many years, and I'm sure you've seen that this particular pandemic has brought in unprecedented changes in most professions. But for a journalist, this pressure has been of a different kind and of a different type. How and what can we do to kind of look at?
I think
First of all,
it's
look
cut
at.
off.
Can you hear me? Hello? Can you hear me?
Yes.
Oh, sorry. Yeah, Dr. Nimesh, I was just going to talk about
Sure.
what are you looking at? How can journalists deal with this unique demand on their psychological and emotional health during these times?
Thank you. Thank you, Vasanthi. Thank you, Vasanthi. Thank you, the organizers. Allow me to say, we all live in different selves. And all remarks, especially Pankajji's remarks, have kind of prompted me to see different selves of me when I make my remarks. As a citizen, I get, and I am worried about what Pankajji summarized so well. But I'll kind of stop there at this minute about those issues of the independence of the media and the structural and the financial implications of how. Second part of me, as a friend of the media and media persons, yes, I do get to know and hear of and interact with the stress and the burden that the media friends carry. But the third self, I guess primarily for which I'm here, as a mental health professional or as a public health professional, let me elaborate on that more, having flagged the first two. First one that occurs to me is that almost no description of frontline workers seems to include media people very readily. When people talk about frontline workers, they justifiably talk about healthcare professionals, doctors and nurses and the other paramedical workers. They talk about the police, but it occurs to me today and it occurred to me earlier that the media persons do not get included as frontline workers. And I think that's one huge gap. We need to recognize that the media persons are at par with the healthcare professionals and the police and the other guys to be frontline workers. And why is that? I'll elaborate a little on that. One is the professional duty to continue doing what one has been qualified and trained to do, besides the financial pressure, but professional duty. Second, there is higher chance of exposure, at least for those who work in the field. And third, there is the stress, as all of you have said. And so there is enough reason why all of us and the society should actually begin to recognize media at par with the other frontline workers. Allow me to share one small bit of information, and I'll put down the details on the chat. We have from the hospital that I work and what is called the State Mental Health Authority for Delhi, we have initiated a telephone helpline, telecounseling services for frontline workers. So I would include media persons there. And I'll get down the details of the time and the phone numbers where it's available. But I have been able to enroll senior public sector and private sector senior most experienced psychiatrists to offer volunteer free of cost counseling services for those frontline workers who might feel stressed. And so I hope that might be useful to those who might be in need across the nation. I'll put down the details in the chat. My second thought is that, like all of you have said, and I'm just recapitulating this more for my learning and summarizing, and correct me if I'm wrong. There are three major factors why journalists and media persons are more under stress even as compared to general population. One is, I put it down in different order, but you all put it differently. One is the lockdown and the whole phenomenon of working from home and all its psychological and social and family implications. Second is, of course, the insecurities about job and the economic sustenance. And third is, of course, the fear of infection. If I'm getting that right, then let me say two more thoughts before I close so that we can discuss more. One is that I really think, and besides the citizenry concerns about what Pankaj said, and I worked in from Kashmir to Gujarat earthquake to Gujarat riots to tsunami to a lot of disaster and conflict situations after that for the last 25 years. I do think that progressively, it always was on the better side. Progressively, all media in India is, I think, getting more and more responsible and balanced, especially in terms of what concerns us as mental health teams. Positive stories and hope-building stories, rather than only sensationalizing or highlighting only the negative parts, which of course is the first duty of the media, especially where there are gaps in the system or service delivery. But alongside that, and I've noticed that from Gujarat onwards, and so I think I really want to say that while that needs to be appreciated and encouraged, that perhaps we could all spread a word to increase, because on the psyche of the general population, print and especially the audiovisual, television, and to the extent social, but television media actually has a huge role in terms of how the psyche works and how well the affected population copes or does not cope. I will not get into details here, but we actually did systematic studies in the Bhuj and Kutch region especially, about the influence of media, television images especially, on the psyche of the affected population. And so while appreciating, I would urge everyone here to see if we can actually increase that more. The fourth and the last point that I have in this brief remark is the data on mental health globally, and certainly in India and South Asia, about disasters, epidemics, and conflicts, and all such similar situations, is fortunately very positive in the long term. Please be sure that I individually do, and mental health professionals and agencies recognize that there is a lot of psychological suffering, including the insecurities and everything that was spoken about. Fortunately, in terms of long-term psychiatric disorders and the infamous PTSD, the American concept of post-traumatic stress disorder, the outlook in India and South Asia is actually much better. In terms of psychological suffering, short-term, and people going through very hard times, yes. And so, see the implication of that. What is required is not so much experts in psychiatry or psychiatric label or psychiatric medication. What is required is informal and semi-formal support at best some formal counseling. And as a case study example, allow me to share very briefly, as per the Apex Court order and which directed all states to do this. Some states have done that in Delhi. We were directed to look at the psychological health and the provide support and counseling for those what unfortunately we call as migrant labor or migrant workers. All those images of people running onto expressways and they were put away on shelter homes. Our teams have looked at and worked with more than 50,000 people in last 2 or 2.5 months. And believe you me, the psychiatric disorders, the level of psychological distress is not any higher in that most underprivileged group as compared to general population. And so I've often asked myself, asked my teams and on a few webinars, say, here is a group of people who are possibly at one of the lowest rungs of the society as it is to start with. They had a very critical time in terms of basics. And so impulsively, they kind of went out to the highways and to reach home, the homing instinct. We didn't deal with them very well, but we dealt with them, I would say, all right. Put them in shelter homes, provide food, provide some support. Our experience in working with them is that not only the psychiatric disorders and psychological distress is no higher than general population, but more importantly, when our teams and other teams tried and build positive mental health, it was easily possible to do so. So the inner resilience of people all across the globe, especially India and South Asia, is very high. And we can still put it to good use for long-term positive mental health. I'll stop there.
Yes, sir. Thank you very much. I think I want to come back to you on the three things that you mentioned about what a journalist is facing, and perhaps you can give us some takeaways for more than 60 plus people who are part of our participants, and also the kind of emotional stress. You rightly pointed out about the resilience part, but it is being tested right now. The resilience is being tested. So it will be useful to have some takeaways that will help us deal with all the three components that you mentioned. So I'll come back to you with that, especially on the health concerns and risks now faced by journalists. So Patricia, I want to come back to you to talk about how are you managing or dealing with the health, specifically looking at health risks or the fear of being infected by journalists, both on ground, and let me also talk about a little bit online, because I think as Pankaji mentioned that the space online has now become a little more active with us, all of us in our more sedentary lifestyles. So how has that changed in this particular period, especially for journalists? Patricia, you need to open your mic. Yes.
So I'd like to disagree with Dr. Nimesh a bit, because we just heard about that journalist who jumped off the hospital, no?
Yes.
Because he had lost his job. Yeah, I forget his name. So that is a huge mental health problem. And I know for a fact that there are many in my state, for instance, who've lost their jobs, those who were with the Telegraph. Then there are others who have had salary cuts, like 20%, 30% salary cuts. They are finding it very difficult to cope, and their productivity has actually gone down. Naturally, with so much of mental health burden to carry, it's pretty difficult. And also, see, we as journalists, and like you introduced me, I'm also an activist. So I do take up many social issues, and I find that this online trolling is really taking a toll on our mental health. In fact, I've been through this quite a few times, but at this particular time, I think it's a double whammy. This whole issue of the social media, whether it's positive, whether it has a positive impact, a negative impact, I don't know what the studies tell us. But for instance, you look at Rana Ayub. Recently, she said that she's got death threats and all that. And what for? Just because she's reporting some truths, which is uncomfortable to certain people. This has been the the plight of media persons today. Like Mr. Pachauri said, you'll have to toe the government line or you don't get ads. Now, do you want to do that? If you don't do that, what happens? So this dilemma is very, very overpowering, and you sometimes do not know how to deal with it.
So true.
Some of the challenges are really extraordinary at these times.
You're so right, Patricia. Thank you for highlighting that. I just wanted to interrupt here because somebody from the participants, Mr. John Dayal, who's a very well-known social activist himself, is raising the issue of, I mean, we are all in our institutions, but what about the freelancers? And in India, there are so many freelancing media and stringers who contribute to the whole ecosystem. Please, what do you think about them, and how are they going through this crisis?
I think everybody is in pain. Yeah, it's not just the freelancers or the ones working with institutions. And when you say institution, it depends how large your institution is. There may be freelancers working with larger institutions. If they suffer a pay cut, maybe it's not as bad as those in smaller institutions. If those in smaller institutions face a pay cut of 30%, it means a lot. So to say freelance and institutional employees, I think it's not a very fair comparison.
Really, because Akaji, you want to add here?
I would like to add to that, and it was nice if John Dayal himself had talked about it. He's he's a very senior person. He's one of my mentors when I started journalism. And thank you, John, for all you've brought. The situation right now is such that people writing for Hindi papers, the freelancers, they get 4,000 rupees a piece. They were told flat ki 1,000 hum kam denge. So this is the level of financial insecurity. So that is one level, Hindi newspaper. The second level is, if you look at the business of journalism today, Times Internet is the country's largest online company. Okay. It's the largest in terms of revenue and in terms of reach. It reaches almost everyone in India which has a phone. It's that big. These are the ComScore figures I'm talking about. So now Times Internet last year had a revenue of 149 million. You can imagine. It's a global company. Now, if you look at the numbers, they had losses of 24 million. So these are the big companies. Also, I talked about 4,000 rupees, and now you talk about Times of India. So Times of India has, they've undertaken massive job cuts, and they've shut down a lot of
publications.
What do you call it? Yeah, publications and bureaus and editions and all that. So they've done that. And this is this news of what Dr. Nimesh Desai was saying about Indians being more resilient. This news is affecting other people who are working under very stressed out conditions. So what happens is it accentuates your behavior.
Yeah.
It accentuates your behavior in a way कि कल को मेरी नौकरी भी जा सकती है. So whatever someone is saying in the government, and my company as it is pro-government, so I should say it more. So that is what I see in journalism, and that is a mental thing, and that's when it comes to Dr. Desai is an expert on this. There's something called a herd, not immunity, but a herd mentality. But this is what we are seeing right now. I have some friends who are telling me this, the herd, कि भाई जहाँ सब जा रहे हैं वहीं जाइए.
We'll all go where everybody.
The migration which started because of that herd mentality, कि 4 लोगों ने बोला कि वहाँ पर गाड़ी आ गई है, सब लोग स्टेशन पर पहुँच गए. Okay? 4 लोगों ने बोला कि बॉर्डर पर बस खड़ी हुई है यूपी की, बॉर्डर चलो, सब लोग बस उधर चलने लगे. Same thing we are seeing in media, that even if there is something, which is so clear, that the experts are saying things like that the China has entered our country, we won't believe it till we hear it from someone who we follow.
Yes.
If the Prime Minister doesn't say that China has come in, they won't believe it. So that is what is happening. The critical faculties of a society are failing us. And that is a very sad thing.
Yeah, and it's affecting the media specifically. That's
And it's affecting the media specifically, and that's why I connected to the financial constraints of the media and the financial stress into the media that's doing it. And media is becoming now, it's spreading something which is avoidable in these circumstances. I remember after 9/11, and I went to a seminar like this. Those days we used to have seminars. That the children living in the slums of Delhi had seen the 2 planes going into World Trade Center so many times, they thought the job of a plane is to hit a building.
My God.
This is what's happening in media today.
True.
That the job of the media is to do this. True. That the job of a government functionary is to provide PPE kits. That the job of the ICMR is to do this. So that is what is happening with us.
Yeah.
We are becoming a herd because we are in such a crisis. Yes. And there's no way out. I mean, I'm talking like an expert, mental expert here, but I'm not. And I also, during my day, during my times, when I was sitting with our company's financials and all that how I'm going to deal with these things in the future.
True.
Now, if you look at the businesses, people have not paid rents. People have not paid their employees. All those are now what? They are weighing on your head.
Absolutely.
They are weighing on your head because you have to pay it one day. Yeah. The government has allowed you not to pay your taxes, your TDS, your PF, your ESI now. But it's going to accrue to you in September or November or whenever. And by that,
and it's going to be cumulative.
Yeah, so those are the things which we have to keep in mind. And people like Dr. Desai can, help people. And if he gives us that helpline he started, we are very happy to do a story on that. So more and more people in the media and frontline, they get to know about it, that there's a helpline and people can ring up. Otherwise, I've become a shrink to my office these days. I'm not joking. By evening, I talk to 3-4, of my colleagues, especially younger colleagues, and talk to them by kya ho raha hai, mummy, papa, theek hai, kisi ghar mein kuch ho gaya, kisi ka kuch ho gaya. People have different kind of stresses you don't know.
You're very right.
People have applied for jobs abroad. People have applied for studies abroad. There's no future. They say, what will I do? I mean, I've just got this admission in one of the top universities in England. And the person is totally devastated because the university is closed down. No one is replying. So these are the kind of things which are happening at different levels. And we are turning into a herd, which is a very dangerous thing. And that has to be broken. And only media can break that, but the media itself has become a herd. Yeah. So we are echoing.
It's echoing. You put it so beautifully, Pankajji. But we have to start somewhere. And for us, this webinar is one way of actually just raising those issues and perhaps looking at it from one slice. The structural issues that you point out certainly are the most important issues that we need to handle, but perhaps this forum is not the right way to do it. But the way we can try to do is to strengthen and empower individual journalists to be able to be much more resilient and sustainable in the long run. And that's where I thought Dr. Nimish Desai would be very important to kind of play this role. He's actually given the numbers and the details of the helpline in the chat box. So do look at that, and I'll ask him to talk a little bit more. But before I go to him and then come back to both Pankaj and Patricia, I wanted Hezekiah to come into this place, because Hezekiah, as Pankaj and Patricia has been talking about, clearly the media is going through a crisis and yet standing up and trying to bring the whole pandemic and the crisis and to the world. So we need to come, when I say we, the civil society, the institutions and other bodies need to be there to support the media to make sure that they are able to do their job much more freely. So what do you think institutions like the UN, the government, or perhaps civil society, and also the peer groups in the media that they're already there, how do you think they can support media in this particular crisis? Hezekiel.
Yes, just a thought. I mean, this is some things that perhaps some of them are not yet done, are in the making. Some things are just ideas that have not been tested. But one thing that this crisis has brought is the sense of community, working together from different quarters, maybe even from stakeholders that were not expected, like the private sector, people contributing, people doing something for the next person. But I must say that our observation is that on a global scale, media has not been a beneficiary of this new spirit. For instance, give an example. Governments have come forward with stimulus packages. Media on a global scale, okay? I'm not talking about in a specific country. Media has been excluded in many countries. If you talk about any special exemptions from taxes or whatever, as an industry, you find that media, is not there. So financially, media has been excluded from any package or any initiative that we have seen. I'm talking about trends. And this is, of course, very worrying. How do we, the reason is, everybody is trying to address the emergencies, the issues that are most important.
Prioritizing.
Exactly. So we are not seeing a balanced approach to alleviating the pains that have been eloquently alluded to in this session by government, by private sector, because the coordination is focusing on certain sectors, and media is not one of those sectors.
No, it isn't.
Yeah, so these are the things that the UN and UNESCO in particular is trying to advocate for. A more coordinated approach to administering stimulus packages, coordinating also, I don't want to call it community contributions, but certainly contributions that are significant from stakeholders such as the private sector, for instance, so that they do include media. Now, this won't happen if we do not highlight the importance of media in the fight against this. This might take time to take root in the policies, in the environment that we operate in, but it is important to advocate, to engage.
True. So
that the awareness is there for the policymakers that even if it's not achieved now, certainly the period that all of us want to call post-COVID. It may be soon, it may not be very soon, but hopefully at that time we will see a concerted effort from all stakeholders to save the vital sectors of our economy, including the media sector. And therefore, it's important to certainly raise awareness and engage. What can activists, civil society do? Engage with government, engage with private sector, but more importantly, raise awareness about these issues, through the channels that we have at our disposal, so that hopefully at some point we will be taken into account as an industry and as a player.
Thank you so much, Hezekiel, for saying that, because another thing that I have noticed in the last few months of my discussions with various colleagues in the media is that this whole sense of community in the media doesn't seem to be existing. I mean, we are all facing individually a lot of issues, but we don't ever talk together to each other. And that's something that I find very surprisingly, unless we are a community that has a voice and that can talk together to others, there isn't something that is going to come out of it. So it's important that we do share. We have platforms like this and more where we can not only talk to each other and help each other in supporting, but the competition and the is so much, I guess. And we don't have that culture of talking to each other. Let me, before concluding, I think the time is going to be almost up. I want to bring in Dr. Desai and then finally go back. Last word I want Pankaj and Patricia to have. But before that, let me bring in Dr. Desai, to talk about the three things that he talked about. Sir, do you have any specific takeaways for our people in this sector who are already working and feeling all the stress that we've all talked about in the last 1 hour? And what advice do you have to survive and make them more resilient for the upcoming challenges that we all foresee is not going to end very soon?
See, seminars or webinars are no fun unless there are disagreements. And so I'm glad Patricia disagreed. Allow me to say this, and I hope I'm really apologize if at all my initial remarks did not convey adequate professional understanding or empathy for the suffering that human race is going through and that journalists, media persons are going through. But allow me to elaborate, and that I hope Vasantiji will also answer your question. There are at least 4 loci that I can see on the mental health spectrum, and I'll make that clear here. Locus 1, human distress. Locus 2, human distress amounting to gross suffering. Now, on both these loci, human race currently is high. There's absolutely no doubt about that. Locus 3, people with mental disorders who might need treatment. Locus 4, complications of those mental disorders like suicide.
Yes.
Like, Patricia referred to. All that I'm saying, please appreciate, is that data and my own experience suggests that the first 2 loci are much more common than psychiatric disorder or those complications. Yes. That's the positive outlook. Let me explain it differently. Please understand, as a person, as a psychiatrist, as a mental health professional, and as a public health professional, my responses will be different. As a psychiatrist, I couldn't be more happy if the entire human race, at least post-2020, started believing that now there is mental health epidemic everywhere. Everybody needs psychiatric treatment. I mean, why would I disagree? I'll be very happy. I don't make money for what I do. I'm in a salaried academic job, but I'll be happy for the profession. But in honesty, I cannot be doing that, because what the human race, including all of you and us, require at this point of time is recognition and empathy for suffering, for counseling and support for that suffering. Number 3, those who are vulnerable, those who might develop psychiatric disorder and its complications need to be helped specifically, identified and led to treatment, so that we don't overshoot doing psychiatry for everybody.
Sure.
Please see that. Yeah, because that's one danger, as some of the Western countries have already done. Now, let me say this one more time. And this is really a bit nuanced, but I'm sure all of you and our attendees will. There's any number of situations where not only any national or state government, but governments across the country, and I'm very non-aligned, be sure. There are very many situations where wrong or misplaced economic or other policies then tend to place psychiatry in the center stage. Let me give you an example. Farmer suicides. Now, as a psychiatrist, my friends and I feel very happy when MS Swaminathan committee includes psychiatry. But then when I think about it deeper, I say to myself, is this really the correct application of psychiatry?
No.
Or is the system misusing psychiatry? Firstly, it does wrong policies, push people in suffering. When people commit suicide, those who are vulnerable to develop disorders, and then we say, come psychiatrists, come provide treatment. So I want to guard against that for all of us. Suffering, so much so, I know, sorry, so much so that the National Disaster Management Authority guidelines that I coordinated in 2009 actually recognizes that almost any reaction in such crisis should be considered a normal reaction and not as abnormal. All reactions are normal reactions to a highly abnormal situation.
True.
Those who need help, specifically at different levels, we must identify them and give them help so that we prevent suicides and psychiatric disorder. I hope that clarifies. Yeah.
Thank you very much, Dr. Desai. I think you actually point out a very pertinent issue that yes, psychiatry is not for everybody, and perhaps what Pankajji's approach is, he's saying he's now become a counselor to many of his counterparts and colleagues, rightly so, because we have to be there for each other first.
Yes,
and I think if we don't listen to each other and share each other's concerns, and only then finally identify, as you rightly pointed out, those who are vulnerable, who need that special help, go to people like you then for that particular help. I think that is one takeaway I get from your advice today. Thank you very much for that. I think we need to wind up because the time's over.
Sure.
And I just want to give Pankaj and Patricia the last word to
Sure.
say, to wind up this particular session. As I mentioned, that this was only an effort to kind of bring the focus to the media as a community, because it didn't really, it was there, but it wasn't being, the light wasn't shining on it, especially in the COVID scenario. So that's the reason why we were doing this webinar. So over to you, Pankaj. What next? How can we take it forward? And especially to the lots of young people who are interested in media, what is your advice? Because in this uncertainty, the light is very dark and dim. What do you suggest? What would the takeaway for the young people would be from your side?
Thank you for organizing this once again. I have put Dr. Desai's numbers already on our channels, so expect some more help calls from them. And thank you for doing that, Samarthan and people. I think what is going to happen after this is that the media is, the control of the media is going to get concentrated. If you look at the Financial Times 100 top companies, at least 15 of them have something to do with the media, which have profited after the pandemic. So these are the Googles, these are the Zooms, these are all these companies who are profiting. But those profits are not going to be redistributed down to people like Assamese newspaper or Patricia's newspaper or my company, because the money it will go up and it will stay there, because they own the technology, they own the marketing, and now they own the governments.
Yeah.
That's one thing about these big companies, they own the governments. They can do something in Australia, they can do something in Ireland, they can do something in India, and the governments have to go with them.
Yes.
Indian government is totally hostage to Google, because the government has hundreds of apps which it creates to help people. All these apps are hosted at Google Play Store.
Yes.
So to fight with Google will be totally debilitating the government functioning in India.
Mm-hmm.
So these are the companies who are going to do this. As journalist practitioners, we have to be aware of these trends. We have to keep talking about it, whatever our reach is. Journalists cannot fight governments. Journalists cannot fight these big tech corporations. All they can do is that they can distribute the knowledge they get about what is happening in the society and make people aware of it, along with making people aware of this pandemic. I mean, we should keep saying it. How many people we meet in a day? You meet someone in the road, you meet someone in a shop, you meet people, just keep telling them, please wear a mask, please wash your hands. Just keep doing that.
Absolutely.
That is the main thing. You look at Hong Kong, South Korea, and Japan, 3 countries where masks were used widely, have been spared this pandemic in such a bad way. So we have to keep doing that, keep information. And I think my job as a media person has now become, that I have to be a public awareness votary and public awareness activist, along with someone who audits the works of the governments and the political parties. So that's an additional work I've got at less pay.
At less pay.
So that is the future of media.
That sounds a little depressing, but I think there is a silver lining to that. We'll come to that. Patricia, do you have anything to say before I do the final wind up?
Sometimes we tend to believe that the government is doing us a favor, by giving advertisements and all. But I think the media the government needs us as much as we need the government for advertisements, because without the media, disseminating news day after day. And I can tell you from experience, last night at 12:45 a.m., the Director of Health Services calls me to say that there were 28 more people who tested positive. Okay, so by the time I was able to do all that work, it was about 1 o'clock. And so I went to sleep. And then at 4:30, Another doctor from one of our big regional institutes here calls me up to say, can you put this news on your website because the hospital is closing down because one patient is COVID positive and everybody has had exposure. So, then you lose your sleep and you lose everything. But you also realize that these people need you to disseminate information. And another thing is that, when we talk of media, sometimes we tend to homogenize. But I think that is also one of the reasons why we don't have solidarity. There is a section of media today, for instance, that is clearly pro-government. And I don't know whether that is still the media that we need. And then there are those of us who are straddling between, maintaining our credibility at any cost. And somewhere the line doesn't meet, the twain doesn't meet. And I feel that this might be our biggest challenge because we have an editors guild, but the editors guild is also maybe does not also encompass everyone from every media. It's a great challenge to kind of build solidarity when solidarity is what is most needed. And I agree with Ezekiel when he says that there must be coordinated aid, because the government here has been promising a lot of packages, financial stimuli, but we don't hear of anything for the media. So what is the media then? Is it, where does it fall? In which category fall? I mean, is it not something that this country needs anymore? Or are we in the wrong profession, or what is it?
Absolutely. I think that's a very important question to leave behind and then to think about and perhaps deliberate upon more. And in my conclusion, I can only say that as the media ecosystem realign and find new models of sustainability, journalists will also need to find their way to balance their responsibility along with the challenges imposed on, quote, the usual way of normal way of work, unquote. Journalism.
Vasanthi, can I butt in? I want to.
Yes, sir. Please go ahead.
See, there is the old concept of IQ, intelligence quotient.
Yes.
And then came the concept of emotional quotient. And then was the concept of social quotient. Now there is, and we need to start talking about adversity quotient.
Oh, wow. Okay.
AQ, individually and as a society.
Okay. Adversity quotient. Yes, I think we should talk about that a little bit more among journalists. Adversity quotient is quite high. I hope they have that resolve to sustain. Journalism as a profession is more important in times of a crisis. Clearly, we've kind of pointed that out. And obviously, along with the journalist community itself, all institutions support, peer support, and all possible support needs to be provided. And we all are in this webinar kind of assure that kind of a support needs to be provided, and hope that will be done in the future. This webinar is one way of flagging these issues, and we will be doing more. And so suggestions are invited. I would like to apologize to lot of people who are on the chat box, given a lot of questions. And I think I have covered them in one way or the other by the speakers. Thank you for participating. Especially like to thank all the speakers who have very eloquently highlighted the issues that we've pushed under the carpet for a long time. I think the focus needs to be on ourselves and how we can do our job better, even in the crisis. So once again, flagging and thanking and acknowledging all the media professionals for their dedicated efforts till now, and it's up to us, all of us together, how we can support them in making a more enabling environment so that they can possibly do theirs in this times of crisis. So thank you once again, UNESCO. Thank you, Dr. Desai. Thank you, Hesikal. Thank you, Patricia. Thank you, Pankajji, for participating. And thank you all the other participants who were there, on more than 60 of them, who were there throughout the discussion. I hope we have many more. Good afternoon and bye-bye.
Thank you. Thank you very much.
Bye.
Thank you, Suraj.
Okay, ma'am.
We can end the session here.
Yeah.
Thank you, Patricia, once again. Thank you, Pankajji. Thank you, Dr. Desai.